Welcome to Therapy Facts with Dr. Jenn. Today we are talking about why go to therapy in the first place. Point number 9 is when you're pregnant. So, pregnancy is a big deal for all kinds of reasons. It's a big deal and it brings about big changes during gestation, during the pregnancy itself, and certainly thereafter. When a woman is pregnant, she has all kinds of changes in her feelings, her thoughts, her behaviors, her physical appearance, her hormones, and anything else we can imagine. And because those changes tend to come along gradually, very often the pregnant woman is not quite aware of how she is impacting the world around her because she is so caught up and consumed with the changes that she is experiencing. So, what a treat to go to therapy, to be able to talk about all of the amazing changes and experiences that are happening during pregnancy and how you are feeling about that. And then to be able to consider what impact you may be having on the people around you. If you are somebody's leader, supervisor, or caregiver, your personality may have changed. Your patience may have changed. Your energy level may be different, and you may not even realize it. Or if you realize it, you might think that being pregnant is enough of an excuse. However, the people around you are not pregnant with you. And so it is fair to them to be able to understand, to be aware, and to manage the impact that you may be having due to pregnancy. Now, going to therapy when you're pregnant is also a good way to think about and talk about the type of parenting you would want to do. It is also a great opportunity to talk about things that you want to pass along to your children or your child and things that you don't want to pass along. In the previous point, we talked about toxic family members. And so sometimes we are able to deal with different circumstances when it's just us. So we might be able to tolerate the toxic granny or the toxic auntie when it's just us. But we might want to think, well, do I really want to subject my child to this toxicity? Or do I want to do something different so that my child does not pass along or inherit these negative family consequences or these negative family relationships or these negative family interactions? And so the answer is up to you. But going to therapy allows you to make choices, consider the consequences, try out the choices, decide whether you can live with the real consequence, and then decide if you want to keep that choice, if you want to tweak that choice, or you want to do something different altogether. Going to therapy is kind of like having an opportunity to do a little dress rehearsal in your life in real time. Gives you the support and the encouragement to be able to go out and make specific choices for your life that may be hard for you to do alone, but with someone by your side who is making sure that you are making the choices that you want for yourself to help encourage you and help you think through and work through, then you're better able to craft the life of your choosing versus the life of default or the life that someone else decides that you should have. So just remember, when you're pregnant, you are undergoing lots of changes. And some of those changes are temporary. But if the pregnancy goes the way you want it to go, you'll have a whole human being as a permanent part of your life. And so going to therapy to talk that through and to work through those changes is a perfect use of your time.